changing lives.
UBC, inspiring Uganda.
Good evening and welcome to Behind the Headlines, this 15th day of May 2024. My name is Timothy Nyangweso. 6 days gone, 4 days left. The national population and house census is still ongoing, especially looking at how bad it started and then it seemed like it's just a storm in a teacup. Picked up and looked better as the days went by, but even as the curtains draw closer to the end, will we see the numbers or the data speak to planning, evidence-based data, but also policies that will inform where Ugandans are, what they need, what services need to be delivered? And I have a panel to be able to answer some of those questions, especially where we are at day 6 as we draw an end to that. You can be part of the show. Let us know what you're thinking on our YouTube channel. Drop your comment there, or go to a number 0709 60 25 92 doubles, both as our text line and our WhatsApp line, or go to our X platform, hashtag UBC Behind the Headlines there. Let me get to my extreme left, Dr. Chris Mukiza, the Executive Director of UBOS. Good evening, sir.
Good evening, Timothy. Good evening, viewers.
It's good to have you. I see the reflector is on, the t-shirt is ready. Is the umbrella somewhere close?
It's not raining.
It's good to have you, and I know it has been a busy 6 days so far. You'll be giving us what is happening there. Next to the doctor is the Executive Director of NIRA, the National Identification and Registration Authority, Madame Chisembo Rosemary. Good evening, Madame.
Good evening, sir. Good evening, viewers.
It's good to have you.
Thank you so much.
And thank you for gracing us with your presence.
Thank you.
Next to her is no stranger to this show, Honorable Paul Omara, representing the people of Otuke County. Good evening, sir, and it's good to have you.
Good evening, Timothy, and good evening, viewers. It's good to have the doctor on the show. He's the man on the hot seat. Welcome, sir.
Next to the Honorable is Dr. Fred Muhumza, a senior economist, the director of the Forum of Economics at MOOBS. Good evening, sir.
Good evening. How are you, sir? How is everybody out there? We are happy that we are here. I was counted, and I'm not just very sure whether the people who counted me had the jacket because I wasn't there, but I was counted.
You were counted?
Yes.
Most important thing is that you were counted.
Yes, so at least we have a sample here. Somebody was counted. I don't know about the others.
Finally, dangerous substitute coming in at the latest hour in the 90th minute to make sure that we score and win as a country. Dr. Sarah Birete, the Executive Director of Center for Constitutional Governance. Good evening, and thank you so much for coming at the last minute. We appreciate it.
Thank you for inviting me, and it's always a pleasure to be on the UBC Behind the Headlines show. Good evening, viewers.
So let's give you some perspective of what it looks like, especially in terms of numbers. Especially we had the last census in 2014. Since independence, we have had 6 of them, 6 of those exercises happening. But since 1911, this is the 11th. The numbers that were according to the 2014 population census are as follows. You see what the numbers look like all the way from 1969 there, all the way to 2014, and the numbers vary there. We can go as far as 2002, which has about 24.2 million, and then we get to 2014, which has 34.6 million Ugandans there. It also gets to the next slide where we show you especially what the demographic looks like on the map of the country there. It ranges between 5.1 to 4.3 in the central areas there, but you also go further to look at what happens in the northern areas, and the scale on the side of that shows you what the demographic and what proposes to look like. And these are statistics that were given to us by UBOS this year when we're celebrating Liberation Day. Finally, we give you the numbers of what 2014 looked like. We had a population of 34.6 million there. We had a population growth of 3%, a ratio that was at 51% female, 49% male, and we also had mortality rate which was at 53 deaths per 1,000 people. We also go further to look at the life expectancy in our country, which is at 63%, and finally the literacy levels that are at 72%. The 5 questions that are being asked as the census is going on, there are 178 questions, but they're in 5 areas. How many people you are, where they are, what they own, the services that are near to them, and how they live. The last census had some very intrusive question like what kind of toilet you had. That was something else there. But let's get to the ED. Dr. Chris, let's get to the questions themselves. A quick update on where we are. It's day 6. What does it look like? We had challenges with the tablets, but also I would like to pass on our condolences as a panel, but also as behind the headlines on the 3 enumerators that passed away, especially on the incidents that happened to them. Give us a quick update. Where are we as a country? What do the numbers look like? What does the data look like?
Thank you, Timothy. Thank you, members of the public viewing us. I want first to make correction. We have only registered 2 deaths, not 3. One was killed by a gang of people when he had finished working on day 2 on Saturday. They beat him and left him for dead. He was rushed to a nearby hospital. When the situation was deteriorating, he was referred to Mulago. And reaching Mulago, he was pronounced dead. The motive of the killers is not yet known. Police is investigating. Because they never took the tablet, you would have expected that they were targeting the tablet or his phone, but they didn't touch anything that was valuable that he had. On Sunday, a young woman from Namayingo got very sick at work, and he was rushed to hospital. Doctors tried their level best, and unfortunately she passed away. Those are only 2.
And the one in Bukedia?
I'm not yet aware of that one.
What have you done about these 2 that you have confirmed dead?
Yes, every enumerator is under UBOS Human Resource Manual, so we handle them the way we treat staff at the Bureau, especially those on temporary assignments, and we have done the needful in contributing towards the burial expenses. We have been represented at the funeral, and the families, we condone with them, and that's it. May their soul rest in peace. The other statement we made was that the beginning was rocky because of challenges of tablets. We issued a statement that the tablets had no problem. The problem was on enumerators that did not have access rights to the census application because they had not been assigned responsibilities by their supervisor. And how they assign responsibility is through the application, through the census system. And what happened is the majority applied through online recruitment system, and whoever applied had a number and a password to enter that system. Now across the road, the interviews were also conducted online. Across the way, other people were brought in outside the system. You know what Uganda is, by the local governments. And they were trained. So when the time came for them to start working, they didn't have the right. So that's why you saw these kids saying, machines are not working, machines are not working. They would use the password that they were using during training, and they would just get stuck.
Dr. Chris,
so,
there was also an incident in Makere Chivulu where one of the enumerators was speaking to be able to access the copy, and the other enumerators were picking their information off that same area. So there were also issues of data where some of the enumerators walked to these other service providers. Are you still saying that there was no challenges in the beginning of this with access to the portal?
No, there was no challenge. The challenge was the logging in, accessing the census application, especially those who had not passed through the system at that time. And of course, when we realized that, we guided the districts, local governments, to ensure that they quickly upload them on the system and they get the access rights, and they did it on the second day. Of course, we had expected that these challenges of access, maybe internet trading, or maybe the server not being accessed, was part of the profiled risks, the inherent risks, but they were not yet residual. And you had, of course, prescribed the mitigation measures of them. That's why you saw we are not panicking at all. It's like, let me give the example to viewers, and you have traveled in a plane. When you are going in a plane and you are taking off, they tell you, fasten your seatbelt. The pilot will tell you, fasten your seatbelt, because he has anticipated that there will be turbulences and when you are moving.
Yes.
But he doesn't jump the ship or tell the passengers there will be a problem, so don't enter this plane. No. But he knows that beginning will be rocky. At the end, the seatbelts are switched off. And also now, by the third day, we are in autopilot mode. Today is the end of day 6, and you have actually performed beyond expectations. As of 9:30 p.m., we have covered 60.2% of the targeted households, meaning we are above our expectation by 0.2 percentage points. And I'm a very happy man. The public should be assured that we are going to cover everybody in the next 4 days. What I saw, why the moods of the people were very low, and they were very annoyed with us, was that we told them to be at home and they expected us to finish the whole country in 1 day. For those who didn't know that it would take 10 days, we apologized to them. But we had already communicated, and our sensitization had been thorough. That will be 10 days. The reason why there was a public holiday was, one, to ensure that as many people as possible stay home and we cover them, especially Kampala metropolitan area. But as it turned out, we failed because of those challenges of access to the system that would do what? Would enumerate. But the most fundamental reason why there was a holiday is for remembrance of the census night. Because even when we come to your home tomorrow, we shall be asking you who stayed in this household on the census night of 9th May. And you'll quickly remember when you got a holiday. And especially, I got a holiday. That is when we waited and we were never counted. So it was, then you remember the people who stayed in the household. So sort of it, maybe it was a blessing in disguise, I want to say. When I come to you, you said you are not yet counted. If I come to you on Friday, you'll not surely forget the census night.
Thank you. Doctor, just a follow-up question before I come to Madam ED there. With the statistics that we got in 2014, and let's look retrospectively to see what that means. What has been the impact of the data you got in 2014, especially in terms of planning and policy for government, because that was one of those that you had, but also just to couple that question, during the liberation this year, you gave statistics in a report by UBOS that said the population was about 46 million. Help us understand 2014 statistics. How did they help government, especially looking that we had 3 or 2 national development plans?
Yes, you have said it. That those statistics form the baseline for national planning. Actually, it is the second NDP that benefited from the 2014. Because the first one was 2010-11. So it benefited from the census, the second, the NDP2, provided baseline information, but also evaluated the performance of the first development plan. Other areas that our census data has been used for is the sustainable development goals. Measuring the indicators for sustainable development goals. It has also helped us conduct inter-census surveys, and notably the Uganda National Household Survey of 2016, 17, and 2020-21, where I've provided the reports on poverty status of the country. We produced the groundbreaking multidimensional poverty index report that is not only reporting the income-based poverty, but all forms of poverty. And that one is an important statistic that is used to measure the progress of goal number 1 of sustainable development goal.
Okay.
We have also used the census as a frame to conduct the demographic and health survey, where we have provided data on mortality rates, fertility rates, vaccination rates, and so forth. And that information has been used for planning, resource allocation, and a policy debate. Dr. Muhumuza here he always uses that data. And I'm very sure that Honorable Omara, my friend, who is a member of Finance Committee and the Budget, testified that they have used the statistics with the best benchmark data from the 2014 census for planning, and the results you can see.
Thank you very much. Let me come to Madam Idi. Your mandate as NIRA is to establish and maintain credible, secure, updated register of all persons in Uganda for national security and socio-economic development. With this register you have of a country, do we really need a census?
Yes, we do.
Why?
Because a census goes beyond the counting of individuals or the register that we maintain to the socio-economic indicators of the country. It doesn't focus on human resources is just one aspect of the census. Other aspects of the census involve sources of wealth, involve livelihood, involve so many other dimensions to our economy. So it would be a pinhole outlook for us to think that the census is focusing on just the individual. The individual is a source of information to the other dimensions of the economy or their well-being or their livelihood. So yes, we do. Ours is specific to taking the biometric, uniquely identifying a single individual in Uganda with a national identification number. And that national identification number is backed by biometric features. Now, it doesn't say anything about your wealth, your livelihood. There is a question on occupation, but it is for at that point in time when you are registering. So yes, we do. But to give you a background,
yes,
in 2014, the population was at 34.6 million, according to the 2014 census. And that was about the time that NERA was, the project for identifying of persons began. It only captured 50% of the population that had been identified as the national population, 16.2 million. So we would never know. Even now we are saying we are going for a mass enrollment exercise, and we are saying probably there are 17 to 20 million people unregistered. But that fact is established by the updates from UBOS on the population of Uganda as it stands today. So we know the ones of the persons we have identified. The scope of work, if we asked government that we need to register all Ugandans, they would say, what's their estimate? Why don't, probably your register has everyone, because we only know to the extent of the biometric features we have on the register.
And I'm glad you've said biometric features, because on the same national ID, it speaks of the village, the parish, and the district where you come from. Generally, it tells you where you are. One of the questions that it's answering for you, boss. Your data helps with registration of SIM cards, with getting bank accounts, with getting a passport. At what point do we have integration of what you have and what they have to ease the pocket of the taxpayer?
Well, when we submit data to UBOS, it is de-identified data, meaning we do not give your personal features to, they deal with statistics. Statistics are aggregated numbers of a particular, observation or feature they are looking for in a data set. So in essence, I wish to emphasize that among the many indicators they deal with, people are just one of them. For example, the length of the national backbone. That has nothing to do with people. The outage, the amount of power from Karuma or Owen Falls Dam, that is got nothing to do with, with people. Cattle, coffee, that sort of data. The data that is specific that we share with them is data on a periodic basis, on birth statistics, death statistics, and aspects of the population statistics that they may require depending on a study that they are carrying out. Sometimes they want to understand how many people are dying by a certain death as based on the information on the register. Sometimes they want to understand different dimensions of our data as a country. So that's to the extent that we share with them. And I must emphasize, because I know this will come up, we do not share personal identified features. When it comes to UBOS, we share de-identified data, meaning your name is not there. Only certain aspects that if someone looked at the data, they cannot zero down on Mr. Nyangweso.
Thank you very much, Madam ED. Honorable Omara, hearing both from the ED of UBOS and the ED of NIRA, what do you make of this census? We are day 6. He gives us a very good number. We're at 60.2%, above average there. 4 days to go. Seemingly they're on target. But when you look at how it started, especially looking at your tweet that came out on Friday, and you said, I have not been counted. You said, me and Honorable Mara too, we have not been counted. What do you make of this census, and where do you see it going?
Thank you, Timothy.
I'm sorry, Honorable, let me add.
Yeah.
2014, 75 billion spent. 2024, close to 300 plus billion going to be spent. Money's worth? Value?
Yeah, thank you, Timothy, and viewers. You know, Dr. Chris is somebody whom I deeply respect in terms of his breadth of knowledge and qualification. So, in terms of his professional prowess, you can't put any doubt to it. What surprised me, though, is actually what prompted me to do the tweet. After waiting at home for 3 days, up to 3 p.m., the whole day, I didn't see the enumerators, so I decided to drive up looking for my LC1. I found him somewhere on the Muyenga Highway, near the Tank Hill, with about 10, 12 enumerators. They had their backpack, and he told me, Honorable, this thing is not connecting. It's not working. And you remember, a week before the actual date, before the 9th, we had discussed about whether this technology will fail us or not. And so indeed, on that day, the young men could not connect. And when I asked them, I said, what is the problem? Didn't you guys do a run and kind of experiment before? They said no. And the answer, and they said they were told the tablets were very few, so it could not be given out. So they received the tablets maybe a day to the event. So, Doctor, what surprised me is that, true to what he has said, we gave a lot of money. This financial year, by the way, the government had not made provision for census, and we made a lot of noise in Parliament, and we said national data is very important for planning, as he has said. And now we are moving towards even maybe a federal union. And we have agreed as East Africans that we'll be reading our budget on the same day. And we agreed also, after 10 years, you must carry out a census. So other East Africans can't be doing it, and for us, we don't have the correct data. So we insisted, give Dr. D all the money that he needs for him to deliver on a very valuable information that we need for planning. So I was kind of taken aback when on day 1, he's saying that the plane was roaring to take off. And so therefore, all of us had to have our seatbelts. But for me, it was actually shocking to say, hey, doctor, my good friend, how come on day 1, when all of us are at home waiting for you, and your gadgets are not working, people can't have access? Because you see, if we are going to recruit, there must be a clear outline. You have been recruited, you've been given a code, you must be given a password. When you are being given a tablet, you have your password. You can't hand over passwords, tablets to people who don't have access or don't have passwords. So for me, that was an administrative overlaps. And if the kind of tsunami had continued up to today, I think a doctor actually would be in a problem. In fact, I thought, is this good friend of mine must be resigning in the next 3-4 days?
Have you been counted?
Yes, I've been counted. And that's a good thing also. If this tsunami had counted, because if you look at what was happening, people are saying, and I see young people tearing, I don't know what they were tearing. They were not being given money. And we have given all the necessary money. which you have described. We've given all the money, and then people didn't have sufficient information whether this is a 50,000 thing per day or for the entire work, and young people were tearing this thing. Where were the supervisors to provide sufficient information to the young people? There was rioting. People were rioting. The enumerators who should actually be coming to our homes were the ones rioting. So what I saw actually was that there was some form of malaise in terms of preparedness. There was some missing gaps. And technology, by the way, we should never abuse technology. It is us who fail to do this thing in time so that it delivers for us the purpose for which we need. One of the things, Timothy, which is good with technology is that doctor is able to, if this information are passed through the system on a single day, it is received at the central system. So you can see the data, which the doctor is talking about, that I'm receiving the information real time into the center. So technology is not bad. But the question is, if you are going to delve into technology, you must really prepare and do a test run severally so that you know when you start, it does not fail you. In banking, you know, I've been in banking for over 25 years. And we have done changeover for banking software system. Because remember, customers are relying on you. You are doing a changeover overnight. The following day, they must transact. You're not going to tell people, you know, for us, we were now running this thing, please forgive us. No, you must prepare, do a test run. So by the time you're saying this is a cut date, you must have prepared and be ready to serve the population. So doctor, on day one, if we were to, you are a statistician, if I were to mark you from 1 to 100, where would you drop the 5%? So as much as they have made improvement, I think as a nation, everything that we do, we must take the citizens very seriously. Because I can tell you there are people who felt bad on day one. That's the only memory you have. Doctor, you might be saying they are having that memory. Some of them are actually bad memories. In fact, people are saying in Uganda, nothing can be done well. Even if you give enough money, you start something very well, it can't be done well. But I just want to commend Doctor that on the 6th day, we are making progress, and he has been able to quickly go back and correct the errors, and for the young people to have now access to the system, and they are moving. I actually drove and I went to the village. My goodness me, I actually found that in the villages, the activities was much actually better than Kampala, you know. So they came under my mango tree, they were counting the people. I was watching how they were doing their things, asking the questions. I said, why are people more effective in the village than in the city where we live? So that is actually my observation in terms of what took place. And those are lessons that we must learn, and we should never take the nation for granted when we are actually given responsibility to do stuff. Coming to NERA also, right now we are considering the budget. They have also not been given sufficient money to count us, to do the registration of people who have not been registered. And we are going into elections of 2026. So you have those myriad of Ugandans who have never been, you know, registered for the national ID. Then there are others who have lost that needs to renew. So they have a lot of work to do, but they don't have the resources they need. So this knee-jerk approach to very important national issues, I mean, as leaders, we must deal with it. So we are going to try and support her to make sure we count every Ugandan who should not counting. We give the national ID to people who have turned 18 and above, and who can go to vote, and they should not be disenfranchised on account of them not having a national ID. And Doctor, between the two of you, I don't know how we can create linkages. You've asked the correct question. In the budget committee, what we have been dealing with very many MDAs trying to have their own hub, their IT system. Where do we have NERA? So everything should be integrated into NERA. NERA should be able to provide the platform for all government IT system, unless you're dealing with something very unique. And that is another waste which we are really chopping off. We said, you know, can't you get it from NIRA? Can't NIRA integrate it? Why should every MD has a hub and very expensive software systems? Yeah, so, Doctor, I don't know whether this one which you are doing, NIRA is the one housing it. We would want you to tell the country. NITA U, not NIRA.
Honorable, just sticking with you, when you look at 75 billion 2014, over 300 billion in 2024, and 10 years in between there, are Ugandans going to get value for money with this census?
The way we are using money now, 300 billion to him for the 10-year period, is something I would support on any day. Because what we are looking at now, like we had, for example, today, 152 billion for just 30% of Oima Stadium. So to finish Oima, you need 507 billion shillings. Now, if we gave him 300 billion to count us and we stay for 10 years, I would support. That would be good money spent.
Yes, Doctor, before I come to Dr. Fred.
Maybe right. The 75 billion in 2014, when you adjust for inflation and exchange rate, what is it now?
You're exchanging our own money?
No. The value of a currency is pegged on a reserve currency. The inflation from that time and now, the value of the money in 2014 and today, the unity value is not the same.
The shilling,
almost
the
5
shilling has
times.
depreciated to the dollar. So
What was the exchange rate then and today?
And the growth of the population.
Then, that time we were using paper. Now we have procured tablets. These tablets are an asset. They are going to be used, as you said, by other agencies, including NIRA, when they are registering births and deaths.
Okay.
They are going to be used by Electoral Commission in identifying voters. So it is cross-cutting. In fact, this budget, if you look at how much per person it's costing, it's similar to that time.
So you're saying these gadgets can be used by Electoral Commission?
They will be.
So we'll look at their budget as well.
They will be. They will be used. We have an understanding, so that we are the same government. We are using the same resource.
Yeah.
And also, the gadgets will be used by parishes. We shall leave two gadgets, 2 tablets per parish, to collect community information system and PDM data.
We're going to come back to that one there. Especially.
So, don't look at the nominal value per se. Look at the real value of the currency today and 2014.
Thank you. We're going to come back there.
You're not going to beat. You're not going to beat a statistician on numbers.
I'm an economist also.
Dr. Fred,
There are also political aspects.
I'm not a politician.
when you get into Electoral Commission, you've walked into that space.
No, I'm just giving assets, that's all.
Yes.
No, that's a very important information.
Exactly, that's what I'm
now
saying,
we
the
know there are gadgets that can be used in elections in 2026. So we are not going to buy gadgets.
No, they will need, they will need some
Software.
additional, because if they have more than 35,000 polling stations, they need to buy. But also, her ID is going to have the biometric identifier and using either fingerprints or facial or iris for those whose fingerprints cannot see. So they will have also to buy the iris identifiers, which will be connected to these tablets. So they will need some money.
I think when you come to the tablets, there are 130, maybe 70,000 of them.
Yeah.
There are 77,000 villages in Uganda, or round about that. there are 11,000 around about 10,717 parishes. So if they leave two at each
Parish.
Parish.
Electoral Commission has fewer polling stations than your number.
No.
Than the,
Yes,
than
they expect to have between 40 to 44,000 polling stations.
stations.
and you have 100 and what?
No,
135.
The ones which can do the work
Yeah.
verifying are 38.
That's what I was going to.
38,000.
They are the ruggedized
The rugged
tablets, which are only 38,000. And even then, let me be specific to the NERA enrollment kit. There are aspects of that tablet that do not work for us.
And I'm going to come to that part of enrollment because I know, looking at your website, already enrollment, recruitment is happening. Dr. Fred, let me come to you. When you look at this national population and housing census happening, isn't this just fulfilling all righteousness for international bodies like IMF, World Bank, to be able to just go and borrow money and not get the gist of why we really need this census?
Not necessarily as well. The IMF sometimes is always popping up into spaces. And some of us this afternoon, I was told, are more IMF than IMF, but I said, no, this is economics. And economics is economics. You always want to separate the doctor and the medicine. So if economics recommends we need the data, we need it. And you want to start from there and say, what type of data do we need? But also must be rational and reasonable. Do I need all these investment of gadgets and what to just for the electoral process? The other day, the NRM has done their registration. They know they are voters. They are going to vote in their primaries. I mean, if it's about voting, we can still get a piece of paper, line up you guys. You get your ballot, it's a piece of paper, tick it, what you want to tick, throw it in that thing as we always do. At the end of the day, let's count how many have come in. Now, how do I identify who is to vote? Now, if I have all the money, then I can get into biometrics, into what? But people know each other. People are told they were sitting under the mango tree. So sometimes you want to be kind to your budget. Because after counting the people, we now need to provide them the services. And remember, we had this discussion last year when people wanted us to do the census last year. We said, you guys, we have a very limited budget. We haven't paid medical interns and senior health officers. Can we first secure people's lives and then count them? And thank God that consensus emerged, because we said in any case we still have another 1 year to get to the 10 years. So thank you guys for acknowledging some of these. I want to be speaking to that dicey situation of the government budget. We can't do all. So we must reach a level where we say the idea is this, but what can I afford to do? Because at the end of the day, after we've counted the people, and we need this information so badly, so strongly. I don't mind us looking for the money for people to get national IDs, because that goes more than the voting. We now already have a challenge when Bank of Uganda says, is anybody transacting more than 1 million? Must have a national ID. But remember, earlier on, we allowed people, Sarah here, to have her relatives, up to 10 of them, because we knew there are so many people without national IDs, and we didn't want them to fail to get phones. So Sarah may have helped somebody out there in the village who sells cows. Now, the guy doesn't even have a personal national ID attached to that mobile phone number. But he's doing his business on the basis of that. Now, even if you ask him to bring a national ID, it is not his. He's actually a man carrying the name behind the system is Sarah, and you're going to ask questions. So we need to become rational into those kinds of things, but you want to be rolling out that NERA and NINTA arrangements to say, in as much as possible, because now the NIN is key in very many things. We even now have other things to integrate. I'm hearing education has also a student identification number. So you want to keep harmonizing those. So those rollovers for me are key. Let everybody get their national ID, let them get their NIN. But now to get into other complicated gadgets that are going to draw down a huge budget for a one-off event that comes every 5 years, you want to rethink and say, where can I integrate? So that the numbers is going to give me, and rightly we use their numbers, I would want even to see them more. I'm glad he has talked about the community information system. We have a health system. Remember, every time a patient turns up at the hospital, their name is taken, their age, their gender, their sex, and many other things, and which this is where they have come from. That data is right now still left in hard copies. So I would be interested in how do we now leverage these copies that they are leaving there to collect all this much information that my sister Kisembo was talking about, which goes beyond mere identification of the person. The socio-economic data speaks to me more strongly as we move in between the census 10 years. And these now tablets, we want to link them to that process. That along the way, the parish chiefs and the people around them can continuously keep picking data that you can get to the corrals, that where people are selling cows every weekend, so that we know how many cows we are sold this Friday and then another Friday. And that trend would be very, very important for local planning. Because right now, we don't even know how many cows. You wait for a national livestock census. By the time it comes, you really have no idea. Government is now going to spend money to buy foot and mouth doses. We're estimating. We don't know which cows are where, which diseases. So that data would be key. And for me, that's why I think the UBOS institution is right, that the 330 billion involves this investment that is going to remain around to serve beyond the 10 days of the census. So I would look at that investment for a longer period. The challenges they have had, I don't want he as well explained them. We should have tested whether the people came through the local government system or not. Now that you agreed even to train them, you even gave them the tablets, the passwords could have automatically been uploaded. But these are challenges of learning in new systems. I'm glad you're telling us you're now at 62%. So you seem to have really picked up the learning problems, and we're now waiting for the quality of the data. Because I'm also getting information of people being counted, but they're like, your questions are too many. I am done. I have to continue with my life. The rest you go and feed in. So the quality of the data will begin to give us some challenges, but I'm hoping a bigger percentage of Ugandans have answered the questions so that the law of large numbers will really even out any weaknesses and challenges. So we need the data as a country and as people who plan and use the data to understand what is going on, especially continuous data. And I'm glad and I'm hoping that the district officials who are remaining with these tablets and gadgets, we are going to build their capacity. Because remember, sometimes we do non-wage cut, zero. So you have been having money to put data for them. Who knows whether now the parish would have the data to put, or how do we work off and online? Those are now the additional areas we want to put in so that we get the real value out of this investment, for us to get real-time data for planning purposes, to understand what the changes are happening. I want to have more snapshots of the population and what changes are happening on a more continuous basis in the health facilities, in the school systems. I'm tired of this business waiting for PLOE results. Then you discover 1 million children disappeared. Teachers do roll call every day. Can that information be picked monthly so that we see where the children are going? Are they progressing? Are they not? Have they just changed the schools? What is happening is very, very critical to get value out of the other public sector investments in these different facilities.
And Doctor, staying with you before I get to Dr. Sarah, this data gives us the quantity of Ugandans, 34 million Ugandans. At what point do we get to the quality of Uganda?
And that's exactly the other continuous information, which NITA is telling you, I don't pick that, but the census does. But remember now the census is every 10 years. So I'm glad that these gadgets are remaining around to help us pick more. Because I can say I put a road there. Karuma has been switched on. A transmission line, is it translating into the quality of these individuals? That requires more frequent observations, which the community should be able to pick up, the parishes. Parishes, we are giving people money to buy and plant. You want to understand what is the difference between last season's harvest and this season's harvest? That's the data I would be expected to come through more continuously. Not for me only at the center. The district planner, the sub-county chief, the parish chief needs this information even more strongly than anybody else.
And one of the questions was whether you have received PDM
Exactly.
in the village, which is very important.
Because we wanted to find out. But now even when you receive the PDM, what is the agro-dealer system? Because it is one thing to have money. It is another thing to find the right seed to buy at the right time and plant it. So the ultimate value out of the PDM money you get, I want to begin to see the yields in those market sales increasing. And I'm glad some of these gadgets should be able to pick that for us. How many trucks of coffee are leaving a certain parish per month, per year, and we see that gradually. Because that's what translates into the quality of life of individuals. That's what will make them happy to look forward to the next census to provide that information. And I'm glad that where the IT systems have come through, we are able to monitor mobile money transactions. We put an item there on purpose. It was for research.
Yeah.
But some people just put in anything. Fine, it might be bad data, but at least sometimes you find it's medical, it is school fees, it is such systems. So those electronic systems are giving us a feeler of how are people doing. I like school pay. Strictly it is for schools. So I can go back and see how much money went into the school system between January and February.
Okay.
That's the kind of data that we really want frequently. So we want to integrate more of these gadgets, but let's get not to drive the budget crazy. That now it must be the technology Americans are using to spy on I don't know who. No, for certain things, let's not deplete the resource that is meant to serve the people after we have counted them, because then it won't help.
Dr. Sarah, coming to you, I was here with Dr. Mkiza last week, and we were talking about some of the things that Ugandans were scared of, data being given to URA for taxation and things like that. How does such good programs, how do we demystify or how do we earn trust of Ugandans to have buy-in in such a program like Census?
You know, that comes from the checklist that the planners of census make. You know, ideally, the Bureau of Statistics have 10 years or 9 years to plan for the next census. So when the census ends, they should have, once in a while, they keep track of, first they will evaluate, how has this census gone? What were the challenges? What are the outcomes? What is there to harvest for the next census? But also the planning should start, because they have 10 years to prepare to make the process better. So on an ideal checklist for census, one would be a clear objective, and this census have a very clear objective and goal. It matters to be counted.
Yes.
Very good, speaks so many things, and should be self-mobilizing for the citizens to really participate and know that it's important to participate. The second number on the checklist should be a comprehensive questionnaire. They've really maybe outdone themselves. 180 questions. Everybody gets scared of this number of questions and the time it will take. But most of the questions are built up to the previous questions, depending on whether your answer is yes or no. Yes. So that reduces the number of questions. Then the outreach and communication plan is the next number on the checklist, and I think that's where there has been a challenge. Because when you look at videos coming in on TikTok, including elderly people who have been counted maybe 6 times, because this is the 6th census for us as a country. But you see people saying, I don't want to spend more than 5 minutes with this team. I don't want to spend, why should I sit down a whole hour? So meaning that they don't understand. So that communication has been a challenge. But also what has affected, or what could have, increased the negative messaging coming in from the citizens is the whole mistrust question with government. What will government do for me even if they count? What has this government done for me? You look at the poor service delivery, it contributes to general apathy amongst the citizens. and lack of appreciation of such important processes. Because if I cannot get a road, a good road from government, then why do I think that the other issues of equality of a citizen and the rest matter to a government that cannot provide basics? If I have poor health, service delivery or education, what is the motivation for me to think that it's important for this wholesome planning, comprehensive planning of a government where basics are lacking? So that also affects the morale of citizens generally in participation of government programs. When you go to the other checklists, basically it should be the quality control measures of ensuring that data, especially the privacy of the personal data. That's maybe I'm the only one on the panel who hasn't been counted. And I know enumerators have been traced in our estate once. The information. I don't know. Or maybe I'll be counted through rumors. I don't know. I don't know. But what is worrying me on the question of privacy is that these enumerators come from the village. I wish they were deployed in the next village. Because how professional are they to make sure that tomorrow you will not hear rumors of saying this family has this disease? I know, because I counted them. How do we, the privacy of a person? I wish people were deployed in the next village, other than the village they live in. Although they need to be familiar with the place they are counting in. But to what extent do they become familiar? And so how confidential, what is the safety measure to make sure that they will remain forever confidential with the information that they get about their neighbors? For me, I am worried about that as a person. Although I haven't been counted, so I don't know how it feels. But we have a law, the Data Protection and Privacy Act of 2019. This law envisages a central data bank, central comprehensive one-stop center for citizens' personal data. I know that we have NITA-U, but we are not yet there. And what I would like to know from Nira and Dr. Mkiza Yubos is, what would it have been like if census is conducted in the same manner of pooling resources, including human resources, the way we organize CHOGAM, the way we organize NAM, to the extent that you don't only leverage data through integrated systems, but you also leverage experienced personnel. NIRA has a network up to sub-county level. What would it have been like if you both borrowed NIRA personnel that are very experienced, that are very professional in handling citizens' personal data, you borrow them for retraining to make sure, because they are going to get a different set of data, but also you use that infrastructure of NIRA for 10 days and only recruit a few people that go to the areas that are not covered by NIRA. How would it been like? Yeah.
You know, the government is speaking a lot, but they are not doing what they are talking about. We've talked about integrating government, but that integrating government is not happening. Exactly what you have mentioned. Now, here is UBOS doing census. There's NIRA with information. Now, Electoral Commission is also coming.
Yeah.
Then you have NITA-U. Now, now since we have moved from...
Yeah, before you go far,
yes,
we are profiling
yes,
all the coffee growing households,
yes,
and we are supposed to spend more money because now the traceability law
yes,
in Europe says if I get a cup of coffee here,
yes,
where exactly did this coffee come from?
yes.
Now, we had told Uganda Coffee Development Authority, they could have put a simple question in the UBOS, who is visiting all the households, to simply say, do you grow coffee? But we are going to spend more money
Again,
to go back to all these households to pick coffee.
options, which
So-
you
so-
peop-
so-
Yeah, which is okay.
which
Dr.
people are
Sarah,
saying.
I think the point you're
okay.
making is very
Sarah
simple.
has
Gentlemen,
Sarah has just
The,
said-
the government,
let the doctor finish.
the government
just
is
said the questions are
not
too
working
many.
together.
No.
Every monkey with his own whiskers. That's
Yes.
what's happening.
Part of what you are
Yes.
picking is the socio-economic
Yeah, yeah. So if I
People,
thank you for the
gentlemen, please,
rejoinders.
let's have Doctor finish. I'm going to come back to you.
Where idea we need the GPS, I don't know.
There are certain things need to be straightened out in our minds. Like NITA-U provides infrastructure,
Yes.
not necessarily data. Now NIRA puts its data on that,
That infrastructure.
infrastructure.
Yes.
Now, talk about the enumerators. The highest number of people NIRA has ever had is 18,000. These people needed 100 and
No. But
But
you are
you can
you are
add on to what
missing
you've
my
got.
point.
Yes.
Yes.
What
adding,
I was saying was that
complementing.
you use the infrastructure of NIRA. Where it stops, you add.
You add.
That reduces the cost, but you also have very experienced personnel in the field.
At least as
That's my
supervisors.
point. I'm not saying NIRA is enough for this exercise. I'm saying borrow the already existing infrastructure. Fill the gaps.
Electoral Commission.
Yes.
And I think that
now,
happened.
Now let me come here. There we have actually leveraged
Exactly.
on government. For example, all vehicles that are being used in the districts, in the 146 districts and cities, were not procured or hired. They are from government. We're using a vehicle from Electoral Commission. We're using a vehicle from ISO.
So that's the resource you've integrated.
Yes.
I'm talking about the personnel.
And now,
And more.
Yeah. You don't
yes,
control one resource.
Yes.
Even tablets.
Yeah.
Electoral Commission had tablets.
No, they don't. They are obsolete.
I hope this one's no, this one.
So,
Okay, if I may finish, Professor, you'll come in later. So, Electoral Commission might also tell the students
That yours is so
UFOs are absolute. They can't also use them. So, we need to be deliberate in integrating these systems, infrastructure, and human resource, so that we are more efficient, first of all, because NIRA staff would have, if you use the NIRA staff as supervisors, then you put people to get data, you would be in a better place. The first day was a logistical nightmare. And I saw a statement from the Bureau of Statistics about 20,000 fake enumerators by local governments. These are things you could have avoided. So my point is to invite government agencies really to learn to work together, to be deliberate, so that if you are to recruit extra people, you only fill the gaps. People, infrastructure, human, all this technology, so that you save, first of all, taxpayers' money, but also use experienced personnel in the field.
Okay.
And the
submit.
servers, I hope we're using.
Thank you very much. Let me read some feedback that has come through. Good evening. I'm in Mitoma district. The exercise is going smoothly. However, none of the LC1 chairpersons was trained on what they are expected to do. As they move with the enumerators, again, LC1 chairpersons were not given appointment letters. Therefore, they do not know how much they shall be given at the end of it. This is Kajina Julius, an NRM Administrative Secretary in Mitoma. Okay? Good evening, Timothy. To Dr. Chris, people cannot sit at home for 10 days, not sure when the enumerator will show up. Wouldn't it be better if you had created zones within the area to be covered by a team of enumerators and assign a day for work in each zone? You would have done this with LC1s and LC2s. We are 7 in our household. Only one at home is ever there. How reliable can the information be that is given by one person for all the 7? Fred Lueza, yet to be enumerated. Okay, finally for this session, no training allowance for enumerators and supervisors so far. No food the whole day for the same group up to now. How on earth can these young people, women, be sure that they may get payment even at the end of the exercise? Doctor, this is extremely unfair. Comrade Rugarama, Chairman, Pan-African Movement of Uganda. Okay.
If I may say something. since
Just
that was
one
the
so that
last-
we- yes.
Yes. So I believe the person, the enumerator who collapsed on the, while working, I have a feeling that person died of exhaustion. Why do you deploy people without basics of a bottle of water, and they are walking the whole day, they are moving, and you've sent out an information, don't give anything to the enumerators? Is this real as a human rights activist? How do you do such a thing?
Somebody
don't
said
you
he
have a
shared,
budget?
Somebody shared lunch with the enumerator.
Yeah, I know. Because I believe one of the enumerators collapsed because of exhaustion. Why? Don't you have money?
Let's take a quick break. When we come back, the debate inside here is hot. Hopefully by the time we come back, Dr. Sarah and I will be counted.
At least we'll have a drink.
Fellow countrymen and women, especially the Bazukuru, as we work towards realizing Uganda's Vision 2040, it is important that we plan based on accurate information about our people and our resources. I therefore would like to announce the 6th National Population and Housing Census that will start on the 10th of May 2024. The information from the National Population and Housing Census will support government, the private sector, cultural and religious institutions, civil society, and development partners in service delivery. It will also provide the basis for planning the provision of social services such as education, health, and transport, among many others, at the national and local levels. When data collectors or enumerators come to your home during the census, please avail yourselves and provide them with honest answers to their questions. This is in order to enable them to process the most accurate information about you, your household, institutions, and community. I therefore call upon all political, cultural, and religious leaders, private sector players, civil society, the media, and the institutions of the government to support this key national program. The successful execution of this census will influence the well-being of all Ugandans and progress the country towards the desired socio-economic transformation. I wish you all a successful census for God and my country.
MTN Mobile kutusaka Usi live in concert kujahazi PM nyonyo Mo hip hop kunarubale Kurokanga 18 Mei 2024 Ena fefe bosi weekend Kama koma rapo na yina freestyle Jangola bomwana wakulu kutemi kama nganiga sasa liva muchamba Misana na chino gatuli marapu melele Pokinga mtuale bidi Yebi mtuale tano Emeza kakande Emeza vivya milioni satu Downloading a MTN Momo app Osaliwe kebitula tano kubuli chikumi Kutiketi Woguli kwa MTN Momo Tiketi ya gula mtuale gumo Ade VIP Ebini chitundu Tulina debote cruise Itedwa musente MC MTN Momo Gibo establishment The angry management
Oh, you like to stay fresh. You wanna compete, tell it be my get. Lighting. Lighting. I can make a lighting up.
Uganda's biggest tourism and travel trade show of the year is here again. The 8th edition of the Pearl of Africa Tourism Expo Poate 2024 under the theme Responsible Tourism will be taking place at the Speak Resort Convention Center, Munyonyo from the 23rd to the 25th of May 2024. It's your chance to connect with tourism and travel professionals from across the globe. Discover travel holiday deals, packages, and so much more. Visit www.poate.co.ug to register and be part of the event. The Pearl of Africa Tourism Expo, Poate, is brought to you by the Uganda Tourism Board.
to something refreshingly different. Putting the brakes on a fast-paced world. Slowing down. Just enough to stand out. Cheers to the beer that does it differently. Brewed longer for extra refreshment. Refreshing Club. Alcohol is not for sale to persons under 18. Please drink responsibly.
Ituba Uganda is here, the new licensed operator of the Uganda National Lottery. They have been appointed by the National Lottery and Gaming Regulatory Board as the official operator for a 10-year period, based on their operational excellence in other regions of Africa.
The National Lotteries and Gaming Regulatory Board is dedicated to ensuring that the lottery is transparent, well-managed, and generates substantial revenue for national projects.
Ituba Uganda was selected through a rigorous process for their proven experience, financial stability, and capacity for successful lottery operations.
Ituba Uganda will utilize advanced technology and expertise to offer an unmatched gaming experience for Ugandans. All funds will support vital government initiatives such as infrastructure, education, healthcare, and sports, with a special emphasis on preparing for AFCON 2027.
So, join Ituba Uganda on this journey
of changing and transforming lives.
Welcome back from that quick commercial break here on Behind the Headlines. Even off air, the conversation continues, but that conversation is for off air. My name is Timothy Nyangweso. I'm joined by Dr. Sarah, Dr. Fred Muhumza, Honorable Mara, the ED of NIRA, Rosemary Chisembo, and the ED of UBOS, Dr. Chris Mukiza. And we're discussing everything the national census, the digital census that is happening right now, that it matters to be counted. One thing we've left agreement on is that we need to integrate. So let me get to Dr. Sarah. Doctor, some of the questions that are here, I know it's some of the things that we have touched, but before I get to the questions there, what does this census speak to devolution of power down to the local councils, local governments? What does it say to us, especially? Has it happened in practicality or the areas to plug?
I think Dr. Honorable Paul Mara put it well. We like working in silos. My budget, my work, my people, we are not yet working together as a country. Yet the common objective is to serve the nation. I saw yesterday the minister in charge of local government saying nobody should blame the census based on him. He has nothing to do with it. He has not been involved in any way. He was washing his hands off. And I was like, okay, this is the national, infrastructure that goes up to the village level. So that goes back to the integration. So when you have a local government system, like I've said, really, integration of everything, not just borrowing vehicles. So you have the local government system with officials up to the village. You have NIRA, you have even some officials of Electoral Commission at the district. So the first thing that should have been done is to say, where is the available resource? Then you say, okay, I need, for example, maybe 50,000 people, but we already have an infrastructure. that gives us 40,000. So we need to recruit temporary people, 10,000, and then borrow these already government officials for this exercise. You need to retrain, refresher courses, but they are experienced, they are familiar with the people, they are, even the people respect the authority because they are the authority at the grassroots. Then you say, I need temporary staff, addition 10,000. And those ones need more training than the people we are talking about. Of course, you will spend on them, but you would spend less. But also you have senior people in the field. So when you have a minister of local government saying, don't blame me for this mess, I don't know anything, and we are not involved, what does that speak of us as a nation? So may I think, and Dr. Mkiza, you will come in, because I'm quoting the Honorable Rafael Mageza, I saw him yesterday. So when you have such situations, and of course then Nira saying, my technology, your technology, no. We need to know, yes, NIRA has specific technology for its specific work. But if then your technology is personal to the work that you do, there are other resources that can be used in the pool. The personnel, the infrastructure, you can keep your technology if it's personal and particular to your work and is not fit for census. But what else can go to the common pool? To ease the burden of a taxpayer, but also give you more quality work than getting people. Local government has deployed fake people. You know, what is that?
Before we get to Dr. Mkiza, Dr. Sarah, when you look at this census come the 19th of May, what outcomes would you expect in terms of governance and services?
Everybody works with data. Speaking from our side as civil society, if I'm designing a program for youth, I need to know these youth. What are their categories? What number is employed? What number is unemployed? What number is educated? What number is not educated? Where are they working from? Where do I find them? We have a flagship program of teaching the Constitution. Constitutional literacy, it's designed around youth because of their demographic strength and multiplier effect on society. So if I have accurate data from UBOS, I'm always reading all their reports, plus details, external labor. Everybody works with data, and it's very important for all of us. And this data needs to be the top quality that we can get as a country.
Thank you very much. Dr. Mhumza, coming to you, NDP3 is coming to an end, NDP4 is in the works. When you look at this census, Dr. Mkiza has told us 60 plus upwards is what they're looking at so far as success. In economic terms, in a layman, what would the outcome of this really be for them? But also, what can NDP4, in anticipation, wait for as it plans for the country for the next 5 years?
Well, these are the synchronizations. The NDP4 is almost complete.
Wow. Without the census?
Yeah, the census will find it out. It doesn't mean that when the census is not there, we do not have enough planning data. There are algorithms they usually use us to give us provisional data. So this is usually going to season out and say this is what it is, plus or minus. So we have had some data to use. I think my other biggest challenge is to what extent do we actually take evidence for planning in this country? Which evidence is going to give to us? He always does. He has very big indicators of youth, we're talking about here, who are not in education, not in employment, not in training. So where are they? Because if you're not in education, you should be in training. If you're not in training, you should be in employment. So if you have a big portion of the youth who are not in there, and that information he regularly generates, but you'll find so many people who you should be expecting to know and be using this information, the way Sarah is describing, to say, I look for all sorts of information before I plan, is going to be missing. You also have a number of policy issues, where you find actually now the policy decisions are not relying to his data. Previously, and I've been following up the health sector information, in the late 90s, we developed the health sector strategic plan #1. We had clearly demarcated how many people should be served by a health center 2, how many should be served by a health center 3. 4, when do you do a district, a hospital, really not necessarily a district. When do you do a regional? By the populations. Now, there his numbers would speak in. Now, Honorable Mara's constituency comes up and says, hey, every parish must have a primary school. Every sub-county must have a secondary school. Every district must have a hospital. Now, the districts, parishes, sub-counties are now determined politically, not necessarily by his population. And so the other day I go to Kinoni. Kinoni is just a village, an area next to the president's home. These, remember, people, the president wrote his letter and said, for every cow, it's an acre. So you'll find these guys in a parish, there are 20 households. Do I follow the population he's giving me to build a primary school? Do I follow the political policy of every parish must have a primary school? And that begins to drive the planning crazy. Because 20 households cannot have enough school-age-going children who are aged 6 to 12 to guarantee and warrant a primary school. So if you are going to follow your planning and service delivery by only the political, and they drive their more influential in some of these places, than the numbers is going to give us, then you are going to have an overkill and an underkill in certain areas. No, so me, I'm looking forward to an opportunity that we are going to allow evidence that is going to come out of this census to speak to our planning. Because if that is not going to be the case, it doesn't matter whether it is NDP 1, 2, 3, or 4. People are now going to split up more of the constituencies. And then you will end up demanding, I need a district hospital because this is a new district. But what is the population in that district? A health center for would have sufficed. So I am hoping that that's another level of harmonization, that once the census comes through, we are going to go back to the technical ways of delivering services and come and use that evidence to say, politics, please remain in as supervisors and oversight guys who do that. But can we allow the numbers coming out of the census inform service delivery so that we don't do too much infrastructure and at the end of the day end up with no money left to pay the doctor and buy the drugs, but there's a theater. Those for me are really the challenges we are going to face, and I'm hoping that conversation, when these numbers come through, is a conversation we shall open up and be able to proceed.
Doctor, especially the gap that is widening between the informal and the formal sector, the widening of the informal sector, Kuiriba, people who are trying to make ends meet in one way or another, this data is going to come out. It won't speak to the standard of living, but also how do we get this informal sector really to be something of an indicator economically?
Sometimes I wonder what we mean by informal, and people have demonized the informal sector. And informal is by our own definition. If we don't understand it, we call it informal. She has the data about these citizens. And most of these citizens are using mobile money to do their business. Most of these citizens turn up at a health facility. They are really educating their children. But because I have a charcoal business that is not registered with the National Registration Services Bureau, whatever, you call me informal. When I look at the data of URA, the bulk of value-added tax is coming out of data usage. Some of the people are not known to her system because she hasn't given them a name. But because she allowed, kindly enough, and government says, Sarah, you can allow more people to use your system. And they are there. MTN sells to them airtime. They are doing their transactions. They are formal people. You can find them. When a crime is committed, security finds them. When we need them. Uber, when I ask for Uber, Uber is going to find me and deliver me where I am going. So what is this thing we are calling informal? Because we don't understand that. So I think we need to come out and say, what is the reality on the ground? And what do we want to do? When you formalize and you don't formalize, how many marriages are registered in this country? So aren't all those other marriages that are not known producing children who are graduating and becoming professionals and good citizens
and moving on with their lives? Do we want to say those are informal marriages? Some people don't even know where their daughter is, leave alone even a traditional marriage. People have got married and they are out there and the parents have no concern. They have even visited but not introduced formally. Now, when we don't see it on the data, we begin to say it is informal. And then we make it a problem. It is not a problem. His data is already showing us what he showed us here. 80% of the people in agriculture. Yeah. We may not even know what acreage they have, what they are growing. So they are informal. But is that my problem? They haven't turned up to line up for food. They are feeding themselves. They are educating themselves. They are not committing crime. We are planning. We meet them because we plan for their children. They come, they go back. They get treatment. We would have better information, which your boss is going to give us. So what do we mean by formal and informal, and how much of that do we want to correct? So I think sometimes we use words that should not be there, especially in our own particular context as a country, on the core things that we really need to move the country to the next level. Let's not hide behind informality is the problem. So many Ugandans are not paying tax. If the bulk of VAT is from airtime, all these young people who are right now as we speak doing TikTok, they are right now watching the Manchester game, they are betting, and you know these days they bet online. So if I needed them, they are formal. Unless you want to tell me the MTN platform, which is using Lita and Mira's data, is informal. So what exactly do you want to do that you have failed to do? Because this man can't tell whether this child is theirs or not now. DNA can sort out that, but for the bulk of the population, they are married, they have produced their children, they have educated them, they are genuine citizens paying their taxes, consuming and working, life is going on. So we need to get back. But all I have said, once we set the right questions, then the UBOS data will begin to speak to that conversation. And what I would want to see is, are there any shortfalls that we would have wanted? Are there any redundancies in the questions? If people are complaining about the questionnaire, that we can reduce on. Is there a trade-off if we reduce the questionnaire? What are we losing? There are certain questions that we can pick through surveys. There are others that we can pick gradually. So you want to pick those lessons, and I know his teams are going to do the analysis, and they are going to give us that information to begin planning for 2034. But more importantly, what other sources of information can we use
I think,
out there?
Yeah, Doctor, for Dr. Mukizas, the main complaint was on the health questions. Do you feel suicidal? Do you spend sleepless nights? Where those questions really, all of them necessary?
Some people even already sleepless by nature of the environment they live in. People are sleeping on the streets of Kampala. What is that? Why do you ask that guy to that question? You were even going to ask him where he slept on the 9th? Give me a break. You are going to get a very good answer. That would be useless to me.
I saw someone respond to that on X and say, with the economy, of course, sleepless nights are
suicidal would be very high, and then to cause
Honorable Mara, let me come to you. I was looking at both the UK and the US, how they carried out their censuses between 2020 and 2022, and it was the other way around. The information was coming from the people. It was a portal where you get in and fill in your information and give it there.
Yeah.
And that information is given. And it was cheaper. Their parameters were different, religion, ethnicity. When you look at that and look at the way we're carrying out our census, how can we do it better, and what are the alternatives there?
As I had said it before, that Dr. Chris introduced this technology, we're all worried it was not going to work. Majority of our people, as much as technology has improved now, we are still in analog setup. Part of the questions he was asking was whether we have smartphones. Many of our people have disability. So it's the nature of the society which we live in, or which we have. And so we are still trying. Majority of our people don't have smartphones. Maybe the data will show us when you finally, look at them. So it will take us time. We are laggards in most of these things. In America, you can't move anywhere without a national ID. How do they call it? There's a term they use. Social security number. And that social security number, everything is embedded in it. Your driving license, your account numbers, everything on that same number. So by just triggering one number, they know everything about you. So it's so easy. You go into some of the IT booths and you do your things and you finish, you go. Our villagers, where will they go? Now we have now to go to them. So it will take us time. I think most of the telecom companies, in my village, they put one about 2 weeks ago, how do they call it? A mask. So now I can call home directly. Until 2 weeks ago, I couldn't call home. In my house, actually, the network was not there. So you have very many villages that are still devoid of networks. So the issue of using technology to do census, I want to believe that, Doctor, when we do the next census, I want to believe that technology would have reached our villages in terms of the connectivity. I think we need to do that. And then proliferation of the smartphones amongst our people. And also people getting user-friendly with technology. With that now we can be able to fill our data on a tablet, on a tablet like this one. Yeah, you fill your details through an integrated system instead of people coming to us. So it will take some time progressively to expand technology into our villages, getting our people to begin to use it and understand it. I think villagers learn quickly these technologies, and some people will support them. And then also the telephone companies, by making sure that there is connectivity across the country. At least the internet is working. Internet is very, very key. And also, I think, a very purposeful planning from government side to making sure that we have the correct national data through NIRA. Continue to make NIRA work. Those who are getting born, we need to capture their data. So that at the end of the day, when you come to a census, there should be no need for the enumerators to go to where we are. We can actually fill those data ourselves from the villages. Maybe the question would be, how confident people will do it? Doctor will answer to say, will they actually fill in the information? Or maybe it will be like elections where others go, others don't. Unless you pass a law to say if you are not counted, there is a penalty. I don't know what we can do, but there should be something that would compel our people to really provide their data to government through a system.
And speaking with you, Honorable, especially you talked about IT, because where we're going, it's technological advancement.
Yes.
And looking at platforms, looking at spaces, NITA-U, NIRA, because you look at telecom companies have data. For you to be able to register your SIM card, you have to have a national ID.
Yes.
Immigration has information, NIRA has information, UBOS has information. So generally, Dr. Mhumza has his information in 9-10 government agencies.
Yes.
At what point do we integrate this information or align it that Timothy is known by his NIN number? Like you said about the social security numbers.
Yes.
And that information is picked. That whatever is needed about me is found there.
Timothy, I think by now we should have made progress, really, if we were serious. Because it is a fact we are still working in silos. The NITA-U, which I was calling NIRA, which is providing the infrastructure for government. Now, what is so difficult about integrating this information so that we can have it in one place? Who is fearing what? Because the NIRA information can be housed at NITA-U. His data can go to the same place. The one for Electoral Commission can be integrated. Because you see, a moment you have the national ID number, you can integrate anything. Your telephone numbers, your Electoral Commission numbers and things like that. You can actually we can know who you are, really. And so we must, as I said, be very intentional in the way we plan as government. Now we are moving into program-based budgeting. The author is here. But why is it that in terms of integrating government, we are still very slow? We are still very pedantic and very silo-oriented instead of making sure. This is not about us, even if you occupy a position. I'm a member of parliament today, tomorrow I'm not. So as long as I'm here and I'm serving, let's do our best for the country. So those who are actually in charge of these things, the leader of government business, I think, needs to now begin to pull everybody together to really begin to look at this thing, national data, integration of information of citizens, and confidentiality, and making sure there is safety and that the arms of government working together is a reality. I was actually surprised when Dr. Sarah said the Minister of Local Government was not involved. Doctor, how can we do a massive census going right to the villages, and the Minister of Local Government
using LOC ones who are his people?
Is not part of the game.
Interesting, because the sixth pillar in PDM talks about the information system there.
Exactly, and the Minister of Local Government is part and parcel of the delivery system.
And Dr. Mkiza will respond to why we don't have a Myoga on the questions. Let me come to Madam ED there. When you look at the challenges that UBOS has had, especially with the takeoff, a few challenges, especially with CAPI there, integration of digital. I know you're coming to enrollment as NERA, and quite a number of national IDs will be expiring towards the end of this year, somewhere in the middle of next year. How do you hope to have learnings from this and also to help you improve in your enrollment and not have the same hiccups? Any lessons drawn from this for you?
A couple of lessons, I would say, and some of them relate to the institution as an institution that is preparing for mass enrollment. Some of them relate to our environment. Some of them relate to our resources as a country. From an institution level, there are issues that we need to address in terms of training. I realize that training can never be enough, because I'm confident that a certain level of training was done. But when a technology device does not behave the way you want it to behave, there is fear, there is apprehension, and especially in such an exercise, you will have, you may need hand-holding of some places where we can call or ask for specific help. So the aspect of training and retraining and having continued, we are now looking at putting information on the kit itself of what to do, so that if you have forgotten, which is only human, you can at least access a certain folder within that machine itself and find all the information, the steps that you were supposed to follow, and see at which step are you stuck. And the other one relates to resourcing. Appropriation for mass enrollment was done in December 2023 for an exercise that is supposed to take off in June 2024. And even
next
then,
month.
Yes, even then, less than 50% of the money was released. So I think even as a country, there is a knee-jerk reaction when it comes to appropriation. For the last 3 years, as an unfunded priority, we highlighted the fact that we need financing for the mass enrollment exercise. So and even now, we are going into the next year and the financial year, and the appropriation for the subsequent activities probably will come under the supplementary budget. But in essence, what my point is that the extent to which there are exogenous factors which impact an exercise that are far beyond the institution. But as mentioned, integration and synergies can maybe help to some extent. But whether you hire a person from NIRA or hire a person from local government, you still have to pay them. So if their remuneration is not available, there is still a funding gap that needs to be addressed as a reality on the ground. Connectivity. Internet penetration still stands between 50 to 60%. So one of our learnings is that we are going to have an offline and an online module, whereby if you are off internet, if the kit is off internet, it can capture at least up to 60 records, which is what we envisage for a day's work, and get to a place where there's connectivity and relay the data. So that's another learning for us, given our circumstances.
How do you plan to have this enrollment?
The enrollment as it stands will be mobile units. It will take the same shape it took in 2014 in terms of execution. Our registration center will have a minimum of 10 kits. Those 10 kits will be deployed at a parish X. That means you will have, since we are hiring one person per parish, that means you'll have 10 people from another set of parishes, including the one from that parish. 2 of those kits will be for first-time enrollment. I've never enrolled in my life. I want to enroll. Of the 2, 1 will be for those who may have pre-registered online. This time we have an online presence. So you can do your biographics online and then go and take your biometrics at the center. We shall not have biometrics online. One of the centers, Zone A, will be for vulnerable people, including persons living with disabilities, children and pregnant mothers. Zone C will have 2 computers, and it will have persons who have come for renewal. Then there will be a place for issuance, and there will be an information center. So in essence, it will be a mobile unit whose stages in an area for 3 to 4 days, then makes a move to another area, to another parish or another area within the parish to take the numbers.
Let's use a practical example. Honorable Mara, how many parishes do you have in Otuke?
Otuke district?
Yes.
64.
And your county?
No, we will use the parishes.
Okay.
So what happens?
Two counties.
Okay, so you have 64 parishes.
64 parishes.
Help us understand how that happens.
So if you have 64 parishes and you have, for example, 60 kits, for purposes of this example, there will be 6 mobile teams.
Per parish? Or for all this?
For that district.
Okay.
For that district. So in a day in that district, people will be in 6 places out of the 64 parishes. They will spend there 3 days or 4 days. So we envisage that by the end of the 2.5 months, they will have gone round the whole, all the parishes in the district. So they will sit here in 6 places. There will be teams seated carrying out enrollment. Then they will move. Then they will move to another parish. So those are 6. Then now we move to 12. Then the following set movement, we move to 18. The following movement, we move to 24. The following movement, we move to 30. The following movement, we move to 36, up to 6 divided by 64, up to about 10, 11 movements, whereby they will have covered the whole of Otuke district.
What happens to issuance?
issuance is still about the same thing.
Wow.
They'll be moving within the district for 10 months.
Will they be able to provide the national ID for elections?
That's the question, because if it's 11 months and the elections are January 12th January next year,
Yeah.
and you're talking about 11 months,
Yes.
it's 7 months to the end of the
We
year.
have exactly 15 months.
That is okay. The ID will be issued as part and parcel of that journey. 1. 2. Authentication credentials for us to know that you are the one who said you are who you are.
Before I bring in Dr. Sarah, why not decentralize this process for people that are already registered? Because when you send me a link and I fill in my data to update...
That one is going to happen, sir. I said there are two sets of things happening. There is pre-registration for biographic data. Pre-registration for biographic data. You go online, you fill in all your 148 details.
Wow.
Okay? All of them, tell us everything you want to tell us. You can only come to the center for taking of your biometrics.
How about the
retina?
existing biometrics?
Okay.
They change. So I am intrigued by issues regarding elections as an election observer. we have 15 months to nomination.
Yes, please.
Of candidates. In the last elections, there was confusion on communication as to who qualifies as a voter or how is a voter identified. And people without practical national IDs had challenges because of the same. So when she says a NIN number is enough, I see the same repeating itself in the next elections.
Okay, government has provided for 24 million cards. Okay, approved the budget for 24 million cards, appropriation will come. So in essence, it is envisaged that all voters should have their cards by the time of the election process.
And she has unfunded priorities, so where are you getting the money
but
from?
But also we have a man on the budget committee. Before we get to Dr. Mukiza's data, estimate number of voters in the next election is 26.6 million. So already we have 2.6 million that are likely to be defranchised in this whole about.
They cannot be disenfranchised because the assumption you are making is that everybody's card is expiring in 2025. Only 15.8 million people's cards are expiring in 2024-25. The other cards will be valid. So there is nobody who will be disenfranchised.
But that's the biggest percentage. Currently, how many do you have?
Today we have 19 million cards issued, but we are buying 24 million cards. So the 15, we are buying 9 million more cards than the people who are expiring, and that 9 million more is the population envisaged who is about 16 and above, who do not have IDs or are not registered today. So that is the logic of the numbers of cards that are being bought. But also we are going to issue a digital ID. So that one, that one will also address the other gap. If you don't have a physical ID, you will have a certain digital ID that is you can be authenticated across any electronic platform with a certain high percentage, a confidence interval of at least 99% surety that you are the person who you say you are.
Okay.
Okay. There was something talked about retina, but I hope you'll respond to it when you
It is
give
not
me
retina, it is iris.
the iris. So at some point, I have to walk to you for my iris and also my biometric.
You have to come to us for your iris.
Not even iris, Irene.
Let me come to Dr. Mkiza. Dr. Mkiza, a lot of challenges you have faced, but one of the things that we credit you for is especially it being a digital census, showing us where we're going in advancement of technology. Any learnings to improve the next census, but also the challenges you have experienced? How are you planning for 2034? And also some responses you have.
I think I start with the response. From the panel, I will start with the question of leveraging the available resources in government. We agree with it. And I was pleasantly surprised by the statements made by the Minister of Local Government. I think public officials need to be held accountable for their statements, because there is a National Census Council headed by the Prime Minister, and the Minister for Local Government is a member.
Wow.
But what surprises me is that he has never shown up in any meeting. Secondly,
So he's not been engaged.
secondly, the census is decentralized. The leader of census in the district is a cow or a city clerk who has nominated a planner to be the district census officer. The same local governments have nominated one, either a statistician or a person from municipal council to become assistant district census officer. And the IT issues are being handled by the district IT officer at that level.
So they are involved?
We are not there. You go down to sub-county, the sub-county chief is a sub-county supervisor. The CDO, community development officer, is the assistant. And in a number of cases, the parish chiefs are supervisors. So I was pleasantly surprised that the Ministry of Local Government is not. Local governments are fully involved. I want him to come and challenge me. The second point is on data confidentiality. All our enumerators have been trained and have taken oath of secrecy, because the Uganda Bureau of Statistics Act has that clause, and the penalties for anybody who reveals personal information, and they are aware. But also, after, when you have finished interviewing, you remember you're not even keeping a record. It's different from earlier, where we had paper you could review. What did this person answer? By the time we reach the fourth person, I can bet you'll not be remembering the answers of the first person. And the records are moving, are going away.
That's the beauty of that thing.
Yes. So, unless your intention was to come and pick, then you keep it for 8 years, then you can still review, where the penalty may be less. But the penalty for revealing personal information is very heavy. It is in the Act, Uganda Bureau of Statistics Act. And we hope the enumerators will not involve in gossiping about that. Still regarding the questionnaire and the redundancy, all questions that are being asked are very critical and important. They talk to stakeholders. In fact, we restrained many stakeholders. They wanted to put a lot of, you heard Dr. Muhumuza saying, you should have put the traceability of coffee. That's another question. Motor vehicle registration wanted us to get vehicles and registration numbers. I've created so many enemies because we had to have a cutoff. And the questions that are in the questionnaire are the minimum that we found that are necessary for the next 10 years. On the issue of health questions, again, this is a request from the Minister of Health and others, because in fact, at the end, you want to find out the mental health of Ugandans. Whether they are stressed, they are doing what, that's the mental health issue. And so, government would know, or these other stakeholders, how to deal with the population that is here. And other questions, of course, are to do with employment levels, literacy rates. At the end of it, when you do all of those questions, you get the life expectancy. Life expectancy is not just a number that just comes. It comes from all of these questions, and therefore, and you can't do a census that doesn't give you the life expectancy of your citizens. So the questions are very important. We urge you, every respondent, to answer to these questions. And in fact, the experience I've had, the feedback, people are anxious are those who have not been asked these questions. But the people who have told us are saying the questions are very good, right from professors and even only this census comic.
That's true.
Which is being paraded by these people who are abusing the IT laws that people put up. But everybody who has faced this question, I don't know whether Honorable Mara felt that was wrong. Before you know it, it has ended. So they should answer the questions. Then regarding the use of our data, in fact, as statisticians, we also feel out that there is no use, there is not enough usage and impact of our data. But now the data collector is the one now facing the wrath that the data we have been collecting has not improved their well-being. We've gone to Parliament and argued that I think government there should be a law compelling government to use the data in their planning. They should show, or in the decision, in the policy they are making, use the data that is available, official data. That's when it will have an impact to the people that you are governing. So there should be a way to make sure that there is an impact of the data that you are collecting. And you have massive data. This is also give us a lot of data. Then on NDP 4, what has been completed is the strategic direction. They are now on the macroeconomic framework, and we have been tasked to be responsible, Uganda be responsible for the results framework. The results framework is to provide data for the indicators, and also to ensure that the indicators in this NDP are smart. They are simple, they are measurable, they are achievable, they are realistic, and they are time bound. And then we make sure that we provide information that would measure those targets. So this census will provide a lot of information to come up with the results framework of the NDP 4. Regarding the possibility of using self-enumeration, we discussed it. Since 2022, we actually started planning for this census immediately the last census started. And the Honorable Mara has actually, it's as if he was in our boardrooms. One, the literacy rates, the ownership, the access to internet connection to answer these. In USA or UK, they use it because there is availability of the physical addressing system, the physical code, the postal code for UK, America zip code. So for anybody,
and the housing numbers.
Yes, for anybody to administer that questionnaire, you have to show all of those characteristics first at the beginning. You are saying my zip code is this, my house number is this, then you progress. In Uganda, we are not yet there. It's not as easy as saying you would have done it, of course. Some people would can answer, but you cannot even trace the originality, you can only see the name and so forth. So there would be challenges in administering that questionnaire. But even in countries where they are doing this online, the self-interview, self-enumeration, in America, it's only 42% in the census of 2020 that registered and administered the enumeration online. The rest, they were still foot soldiers. You remember when Donald Trump, on the way, stopped them thinking they were campaigning him. He stopped the foot soldiers from going house to house because there are so many people who register. As you start, the registers are for us which are not be able. And this was 58% of Americans. So if in America they still do that, and you know our Uganda, we have to really adjust in the context we are in.
Lastly,
finally, we planned extremely very well. We trained everybody. That's why Paul Mara found his people working better than these campaigns. All these up-country districts, on first day, each enumerator had finished an average of 15 households.
So what's the urban challenge?
So, and now come and support Rosemary's argument that as you plan, the external factors end up mattering most. The environment in which you are operating. Campanians are not illiterate, but we are working in a very tricky environment here. Much the same as everybody wants to be counted. There are other people wanting to fail this exercise.
It's just terrible.
Otherwise, how do you explain a person from Kisoro being able to enter, a person from Motuke, from Naberatuku? The first day Naberatuku had the highest. And here in the center, where internet is, people are failing to access.
Okay.
So you can model those external factors, but managing them is not as easy as we are taking it like that. But the good thing is that we have sailed the storm, and what makes a sailor are storms.
Thank you, Doctor.
Omara was saying I would have resigned. But
If you had continued the way you said
I was very sure with my team that we are succeeding, and we are succeeding already. Our performance has exceeded the expectation. In fact, we are even surprised how we are moving.
Doctor, I hope those are your closing remarks, because I'm going to start with
No,
Dr. Sarah.
Dr. Mkiza should tell us one thing, for the viewers, not the panel. Have you paid the daily allowances, or when will they be paid? Because this is now the most outstanding challenge there.
Yes, the daily allowances will be paid at the end of the work. If you risked paying these daily allowances today and they run away, you will do your work. But the money they are supposed
to... Gentlemen anyway, and ladies, I'm going to ask that I give Dr. Sarah, Dr. Muhumza, Honorable Mara, Madam Edie, and finally you, closing remarks, each of you starting here.
Yes, just in my 1 minute, I'll say two things. One is that as a human rights defender, I still feel these young enumerators in the field should have been paid 50% of their daily allowances. Because most of them don't have even access to a bottle of water, yet they are walking, moving, talking to people the whole day. It's not fair. But to the citizens out there, if you've not been counted like myself, let's keep hope alive. It's important to be counted, and it's necessary for our comprehensive planning and functioning as a country for all stakeholders.
Thank you very much, Dr. Sarah. Dr. Muhumza.
It's really a balancing act. I hear the next phases, you get appropriation, priorities come in, and then some money don't come out. Let's be realistic. The call upon integration, the call upon realism is to really say, let's not only end at building the foundation of the house, which is what data speaks to and all this information. Let's be mindful of, do we have money now to offer what the NDP for is going to ask for. So that mindfulness for me is going to be key, because the welfare of the citizens should be the ultimate result that we want to get. And talking about the indicators, talking about is that's what we want to see, not to just say this was done, but how is the welfare of the citizens changing? Picking that information and financing that process will be key.
Thank you very much. Honorable Mara.
Timothy, the importance of this census cannot be overemphasized. And Doctor has talked about the importance of the data that we are going to collect. For me, three things come out. One is representation. There are MPs who are in the parliament who are coming from one sub-county or two. And the question is, how are those constituencies demarcated? Because the law empowers the Electoral Commission to keep on reviewing constituencies on the basis of population.
After 2 years after the census,
Yes.
except it's been done wrongly.
Exactly.
You review every year, yet it's once in 10 years.
Exactly. So now we need to use that data on population to redemarcate constituencies. And what benchmark are we going to use? Doctor, you'll help us with that. The second one is on infrastructure. You see, if the population are many here, we just need to make sure in terms of the available infrastructure and services we provide it there. And then the third one is health services. I come from Lango, that region has only 2 hospitals, the regional referral hospital and Apache. I don't know when they were built. In Otuke, we need a hospital. But every time you ask, they said, we don't have the numbers. So what is the ultimate number for a place to have a hospital? So you have basically, districts all over the country that should be having a hospital. They don't have it. And the argument has been from the Ministry of Health, you don't have the numbers. Your population is not yet there. So this data will help us to make drastic policy measures, policy decisions for the good of citizens.
When we switch policy from politics, then we'll get there.
It might confirm that the numbers are not there.
Madam ED, your closing remarks?
Thank you very much for the opportunity to speak to the public. We do have an upcoming mass enrollment and mass renewal exercise. In order to stem such exercises, to have lesser and less of those, we wish to also promote birth registration before the age of 1. Government has taken the extra step of removing fees from birth certificates for children under 1. So we want to invite the public to stand up and be counted, to participate in the mass enrollment exercise and be identified, but also to register births in the year of the birth.
Okay.
So you will, in the process, ensure that unlike the census, you will not have a mass enrollment exercise every 10 years.
Thank you very much. Lastly, Dr. Chris.
Thank you. We are calling upon those who have not been enumerated to be patient. We still have 4 days to go. We have asked the LC to be vigilant and ensure that every homestead is counted. We are calling upon the residents who have not been enumerated to get in touch with the LC chairman, so that they can make an appointment indicating when they can be available to be counted. The last 2 days will be weekend, and this time we shall not betray you. We are going to comb those who will not have been counted, and let's have this a success, because everybody here and the public there acknowledge that this census is important for the data it will generate. And so far we are very happy with the participation of the public.
Thank you very much. Let me read some feedback. I am Philip from Karamoja. Very unfair for the U-Boss ED to tell people that they shouldn't give enumerators food or water. I don't think he said that. For me, I provided break, tea, and lunch. Thank you very much. I will leave it at that, Philip. I kept home since Friday. the 10th to today. When I walk nearby my grocery, I come back 30 minutes, only to find a writing on the gate telling me the numerators were here and I should call them to tell them the truth. I have not been counted. Godfrey Inseta, okay? Thank you for the show. I feel sorry for Dr. Mukiza. Some panelists are acting like football spectators. Cannot kick a ball, but they're shouting players and should have done this later, okay? Thank you very much. I will jump up here and see the last one. Thank you for hosting them. Some of us have IDs of which some of our details are not correct. Will they allow us to change the data? For example, my name is Jibra, and I am on my ID I have Jible. So how do I make sure I get the data there? Madam Idi, I think we need to have you again to really emphasize enrollment and new issuances there. Ladies and gentlemen, thank you very much for coming. And I really appreciate that. We'll end it this way. The only impossible journey is the one you haven't begun. Good morning.
UBC, inspiring Uganda.
The new Silk Road, Ukraine, and more, as our correspondents in the region explain.
One thing that you can see when you arrive in Beijing is opportunity. It seems that big money is around every corner here. And this year's, my visit here is no exception. So Vladimir Putin